right, welcome back, everybody. What you eat over the holidays could actually increase your pain because certain foods can produce inflammatory response. We're talking about red meat, dairy, peanuts, carbs, maybe.
I love them all.
Alcohol.
I like them all.
Sugar. Dr. Jon Dean, Oakland Lifestyle Medicine, is here with some ways to help ease your pain. Let's just talk about the relationship between food and pain. How does that, explain to us what happens in the body.
So there's actually two different ways that what you eat can cause discomfort in your body. There's a short-term immediate effect, and then there's the long-term effect. The short-term effect, as you mentioned, is going to be from that inflammatory response. Everybody knows that, you know, if you roll your ankle, it gets puffy, swollen, red, very tender and sore. But what most people don't know is that the foods you eat can actually create inflammation throughout your entire body. We call that systemic inflammation. And a lot of times that can highlight some underlying issues or injuries that you may have in your spine or elsewhere. You got to be tested to that to find out what you're actually sensitive to. There's some very common ones like you mentioned, dairy, peanuts, and things like that. But there's some hidden ones that people might not even know about unless they get tested for it.
Yeah, sometimes you hear people when they give up sugar, they start to walk straighter and taller and feel better. The joints feel better.
Absolutely.
So that's that inflammation.
Cutting down on that systemic inflammation. Sugar is one of the major causes of that, especially in this country.
All right. So if you do start to, throughout the course of the holidays, feel bad, there are stretches you can do to loosen. What does it do? Does it get rid of the inflammation, or what does it do?
Not necessarily. So you'd have to change your diet. Things like losing weight can help as well, depending on where you're at with that in terms of your diet affecting your pain. But if you do have pain, there are some easy stretches that we can show you guys to do that can help with that, especially if you kind of want to skip over the inflammatory stuff and eat it anyway at Thanksgiving dinner like I plan on doing.
I'd like to do exactly that. I want to eat what I want to eat and drink what I want to drink, but I want to stretch properly afterwards.
So what do we do? Derek is here to help.
We're going to start off on our back here, Derek.
Okay.
All right, we're going to lay it on our back here. And the easiest one that I like to do, we're going to start with our legs straight here, Derek. This is called a knee to chest stretch. So we're going to do one at a time. We're going to bring the right knee up. You're going to grab that with your hands and you're going to pull. Now, you do want to be careful over the holidays. If you're feeling a little bloated, a little gassy, I will tell you this stretch is going to get things moving here.
What are you saying, Doc?
You know what I'm saying. We're going to switch to the other knee there, Derek.
Okay, very good.
Yep, there we go. And then we're going to do both these at the same time.
So this is to relieve what?
This is mostly low back pain, but it can
Okay.
certainly relieve some bloating and some discomfort from eating too much.
That is where I feel it, in the lower back.
Yep, yep, it's a good stretch. All right, let's flip over here, Derek. We're going to go on our hands and knees here. This is another really basic stretch that you can do. This is called a cat camel. We're essentially going to lift our head up and we're going to push our chest towards the ground. We get a nice arch through our low back there. And then we're going to do the opposite. We're going to round that back up, kind of like a camel. Chin gets tucked or down. And you go back and forth like this. This is going to create a lot of good spinal mobility here. And this is a really simple, easy stretch that most people should be doing, especially like in the morning when you wake up. And then we can go right from here.
Good job, fellas.
How am I doing?
You're doing great. Great posture.
Are you feeling any gassiness?
No, I feel the gassiness and the bloatiness exiting my body.
Yeah, it's leaving. I can smell it.
Well, wait a minute, actually.
All right, and then another one right from this position here is child's pose. And we're just going to go straight back and keep those arms straight. And you're trying to get your butt as low as you can to the ground here. This is a great way to decompress your spine.
I'm glad we're doing this because I do have a child's pose question because I see a lot of people do child's pose with like the knees farther out.
It's really up to the person.
Okay.
I do them either way. You're going to get more of a hip stretch the farther out your knees go. But it is a little easier to bring those hips in here. You're going to get more of a stretch the wider that your legs are. So that's actually a great point.
I feel good.
Yeah.
Thanks.
Good job, fellas. Derek Kevra, thanks, buddy.
You're welcome.
You stepped up. You took off your shoes.
I stepped up
stepped in
by getting down.
There we go. Oakland Lifestyle Medicine. All the information you need if you're feeling a little tight. Let's head over to Ryan.